Thank you, Dr. Fatma. This has been a very enlightening discussion. And now we move on to our final part, where we are shifting gear to ethics, right? Can you tell us what is common between the contemporary medicine ethics vis-a-vis the Islamic code of ethics from the Islamic medicine? Yeah. What do you think is common? We start with what is common.
Sure. Yeah. That's a very good question. Thank you. And I think there's a lot of commonality. The differences are fewer than what is common.
Okay.
And this we can say Alhamdulillah, because predecessors in Islam who decided to start the field and practice of medicine were really Muslims. In the from late 6th and 7th century, they are the ones who started the practice of medicine, and when they started it, they already had ethics. The world, most medical people don't know. They think historical health professionals Avicenna, and they think that is a Roman Italian, and yet it's really because the West couldn't pronounce his proper name. He was called Ibn Sina, and several others whose names were corrupted to sound European. So people think medicine and health practice and provision of health started with the Europeans, and that's not really true. So the common ones are many, yes. One is to do good. If you're going to touch a patient, make sure you do good. Two, of course, coupled to that, secondly would be do no harm. Try to do the good without doing any harm. And if harm must be done, then the good should be greater than the harm. So then justice, both have justice. Number three, in that you should treat each patient equally. Not treat the rich ones or your relatives better compared to the poor ones or those you don't know. So equality in both the physician to patient, but also in the provision of in a country, the provision of the medical services. And then there are rights or that different people have that are in both. For example, the right of a patient, right to information, right to give consent, right to refuse treatment. That's one. And then there are rights of the physician that he gives to his fellow physician. To respect. Actually, respect is to everybody, to the patient, to the fellow physician, to the colleague. That mutual respect is to be practiced, and to other colleagues, and then the obligations of the physician to the patient, and the obligation of the physician to another physician. And one of these is that when a patient requests that they would want a second, third opinion, the physician is supposed to facilitate that by providing a good report and saying, okay, here's what I've done and this is what I found. You can give this to the other health professional and see what he thinks. But together with this, the professional himself, the health professional, is supposed to realize when he reaches a situation where he feels his knowledge and skills are not enough to take care of that patient, he himself should say, I think I need to bring in another physician, another specialist in this other field, because I'm not an expert in that field, without the patient having to demand for it. He should suggest and recommend himself and facilitate it, so that the patient gets the maximum care. And not to get annoyed at the patient when the patient suggests to the physician that if I'm having a problem with my kidney, and you're not a specialist in the kidney, do you think it would be good if you could ask the kidney specialist to also come and see me, you know? So all those rights, and then there's the confidentiality, whatever information that the physician is getting from the patient, whether he's in practicing contemporary medicine or Islamic medicine, that information the patient gives him, he's supposed to the patient is confiding him, knowing that the physician will not reveal this information. Unless in very specific circumstances, and then those are delineated in the ethics of both, where this information then needs to be shared, but many times not without the consent of the patient. So confidentiality is a very important part that occurs in both. The care that is to be given in both contemporary medicine and is not supposed to, the physician is not supposed to look at it from his own financial benefit. It's in both. The physician is supposed to give the care and not think, if I do this, I will benefit more than if I do this. Both ethics have it.
So the best quality care.
Best quality care. And most importantly, when a patient is brought in suddenly, it is in both ethics that the patient should be treated and not first being asked, can you first give a deposit of a huge lump sum of money before any health professional will look at you. And it has happened that some patients have been wheeled in, accident victims, and because of these delays, the patient dies before they have been treated, which is really very sad. That's in both. Monetary benefit is not to be the prime concern of any physician in both ethics. What his prime concern should be to do the good and see if they can, the other principle that I'll now bring into, they can preserve life. One is in both. To preserve life is important. And secondly, if you can't preserve life, at least to improve the quality of that life of that patient. As he said in oncology, if you cannot add days into a patient's life, at least add quality. Add life into the remaining life that patient has. So quality of care is important in both. And to preserve life, means when you're a physician, and in both ethics, it's, for example, it's in a crowd or in a traveling vehicle or aeroplane. Suddenly one of the travelers or on the road collapses, and somebody announces, is there any medical profession here who can assist? It is the obligation of the health professional to say, yes, I am, how can I help? If they've been asked. But before they've been asked, if they are passing an accident on the road and they can see that there's nobody doing, at least providing some first aid to the person who's been injured, that's part of their community service to stop and say, excuse me, I'm a physician, and let me see how I can help.
Okay.
Well, while somebody tries to call an ambulance, let's see what we can do.
Okay.
You see,
Okay.
so there are a lot of all those commonalities, and the rest of them are really just common sense things that have been put into both ethics, and those are the common things. And so, like I said before, the majority are very common.
Okay.
The differences are fewer.
Okay. So just to summarize the common, we said it's justice. We said equity. We said do no harm. So for
beneficence.
Me, the beneficence. So because that sometimes you have to do the lesser harm. You need to do the lesser harm for the greater good.
Yes.
For the greater public good.
Yes.
So sometimes you might need to disclose information for the benefit of the public, rather than it would be maybe the lesser harm, because if you don't do it, you'll get a greater harm. So you do a lesser harm to prevent a greater harm.
Exactly.
Right? Okay. And then you said about respect, mutual respect to colleagues, but there's this issue about charging. Yeah, we said that if you're a colleague should not charge a fellow colleague or their relatives, right? That's common in both.
It is common in both, but I think in the contemporary medicine, it's not being enforced. So you'll find some physicians will not charge their fellow physicians, while some will charge. And part of this has been influenced also in the way that people pay for their health care. Before, it used to be out of the pocket of the individual directly. Right. But now it's actually indirect. The individual pays the insurance company, and then the insurance company will pay the health professional and the health facility. Right. So because now it's indirect, it's sort of been hidden, and therefore it's not so easy to enforce it, because you say, oh, but you're not the one paying, it's the insurance company paying. So that's a little tricky.
Right. Shukran, Dr. Fatma. I think we have covered quite a number of things that are common in both the medical ethics and the Islamic code of ethics. Is there any that we might have forgotten?
I think we've forgotten one. But before I say it, I was just thinking through and marveling at the fact that everything, all the ethics that are in the contemporary medicine are all included in the Islamic one. But the Islamic code is richer; it has others. So the one we haven't discussed is autonomy, and it is in both. That the health professional should not think he is the one who knows it all, and that the patient knows nothing. He must respect and give the patient a chance to make a decision for him or herself. Even if the physician feels that decision is not correct, but if the patient feels that is the best decision for her or himself, then the physician has to respect that. And secondly, for those who cannot make a decision, of course, guardians, parents, like the children, will be used to make a decision. But there are those that, shall we call them the special needs group, that may not be in a position, even if they are already adults, they may not be in a position to make what the best decision for themselves. So it is the physician's responsibility to make the decision that is best for that patient, not best for himself or for his institution. And so this gives the physician actually a lot of obligation, in that he knows that this patient has no idea what is good for him or what is not good for him or her, but I, the physician, must make the best decision for him or her.
Well understood.
So I think that's a very important ethical principle that is in both, and it's to be upheld.
All right. So now, what is different in the two? I think you had already started talking about
the difference is, I think we might have mentioned here and there. One is that there's no mention of God or Allah as the supreme healer, that we as health professionals just treat.
Yes.
But the real healer is God, our supreme being, whom we all believe in. That he has those powers. We don't have that power. Even when we do give those medicines and treat a patient and the patient gets cured, it's not from our intervention. It's really God's intervention that made that person get cured through those medicines. That's what we must realize.
Okay.
That's one. And two, the fact that justice is not really expounded very deeply and or practiced very well in contemporary medicine, compared to in the Islamic medical ethics, because for the Islamic medical ethics, justice means everybody must get equal care, whether you are rich or poor, whether you are related to the physician or not, or whether you come from the same ethnic group or not, whether you are the same gender or not, or you belong to the same political party, for example. In Islam, it is expounded so much such that in some of the good Islamic states, there's no private practice, and there are no private hospitals. You see, in Kenya, if you have the money, you can go and get the best care in the best private hospital. But if you don't have money, you have to go to the public hospitals, where sometimes things are lacking, machines are out of order, and they haven't been repaired. There are those challenges, and therefore you don't get the best medical care, even though you are the same citizen in the same country. And I think it's good that some of them, Muslims with countries or countries with Muslim majorities, have given free medical care to everyone, and they don't have private hospitals there. All the hospitals are run by the state, and the care given to the richest person and the poorest person is exactly the same.
Very good.
Yeah. So that's secondly. The third is the physician is expounded more in the Islamic principle that he has to do the good for humanity, because he has the knowledge, he has the skills. The humanity, the lay people don't know, but he knows, and so he must use his knowledge and skills to do the best for humanity. Fourthly, the physician is supposed to give sincere counseling and advice to the patient. It's expounded very well. It must be sincere, with no ulterior motives. And then in the Islamic principle, another difference is when it comes to a person who's brain dead, but is on support, machine support, life support. Who should make the decision to switch off the machines? In contemporary medicine, it is the family. The closest, family members are the ones to make that decision. And then when they made that decision, the medical profession just follows their decision. But in Islamic medical ethics, it is a medical decision. Therefore, 3 different specialists must be called upon to come and make the assessment and decide, yes, this person is actually brain dead. But even after they have switched off the machine, they've agreed. You see, to get 3 specialists to agree may not be that easy. But when they've agreed, then it means it's the correct decision.
Right.
And even after they've switched off, these 3 specialists are now supposed to confirm whether the patient is still living or has died.
Okay.
Because it's possible you can switch off the machine, but if Allah has not yet decided that the patient's life is over, the patient may continue living.
Right.
And therefore they cannot pronounce that patient dead.
I mean, to me, the patient will still be on oxygen, still getting
They will-
the nutrients or the IV fluids, right?
Yeah, it will.
They're not just
Meaning
everything.
it
is
wasn't
shut
on
down.
you see, on life support, it is the machine that is making the heartbeat. It is the other machine that's making the lungs expand and contract
Okay.
for exchange, and several other machines doing different things in the body. So when these have been switched off, still those specialists are supposed to wait and assess: is this patient really dead? Even though they had confirmed the patient was brain dead, but the patient's lungs may now take over and continue breathing. The patient's heart may take over and continue beating.
Right.
You see? And therefore, they're supposed to continue still caring for that patient until the time when Allah decides, now this patient's life is over, and now everything stops.
Very good.
Yes.
Okay.
So that's a major difference.
So, like,
between
if we
the two.
say specialists, it would be what? Like
3
a
specialists.
cardiologist,
Yes.
a neurologist,
Could be a hand,
and a physician.
and probably
maybe
a
that kind of mix.
that kind of mixture. A physician or a chest physician,
anesthesiologist.
anesthesiologist, yeah. The specialists, people who are specialized in chronic care and end of life
Okay.
medicine. So
Okay.
and critical care medicine. So a critical care specialist needs to be one of them.
Okay.
I think this in Islamic law it hasn't been decided, because I guess it would depend this patient, what was the original diagnosis,
Right.
what was the cause of them going into a coma.
Right.
So it might require another specialist for that particular disease or condition that patient was having.
Okay.
But at least they've specified that there must be 3 specialists, and that it is a medical decision, not a family.
What if
decision.
it was like the patient's decision? Before the patient got into that kind of situation, patient said, if I ever get into this kind of situation, please don't put me on a machine. Please take me off. Or if I'm on, after 1 day, switch off. What happens?
So here's the difference. When we'll have to go back to the first difference that I talked about.
Respect for autonomy.
No, that Allah is the supreme healer, and maybe I didn't expound it. Not only is He the supreme healer, but He is the one that has the right to give life and to take life.
Right.
Even I don't have the right to decide that when I've reached this situation, just stop. Let me, let me die, because then that would allow suicidal people who commit suicide to do it. And yet in Islam, committing suicide is not allowed. Even if I'm having a chronic, untreatable condition, still I cannot commit suicide. I have to be patient and wait until Allah.
Right.
I just pray and ask for sabr and pray for forgiveness and perseverance until Allah decides for me when is the time that He will take my life.
True.
So we have that respect, that authority of that Allah has to give life and to take away. We in the medical profession cannot usurp it.
Wow.
Yes, it is His and His alone.
Wow.
So that I think is a very critical difference. And finally, another difference that in Islamic ethics and not in contemporary, is that if a physician makes an unintentional mistake, apart from apologizing to the patient, he is expected to compensate the patient.
Wow. Okay, so liability.
Liability.
Fully liable.
Fully liable. So that the physician is conscious all the time of doing his best and using his best skills.
Right.
But if he makes a mistake, it is in fact, he is the one who probably will realize it before the patient has realized.
True.
And therefore he must own up and say, I did this and I should have done this instead. And because of this is going to happen to you. So it's my mistake, I apologize, but I'm going to compensate you.
Okay. And in contemporary medicine, what would happen?
In contemporary medicine, it's taken more of, unless it can be proved that he was negligent.
If he's not
then
negligent,
the patient
is compensated.
Is entitled to compensation.
Wow.
Okay.
And so that encourages the doctors then not to admit liability.
Yeah, but you see, because when we are training doctors, we are not bringing in God and Allah and the Supreme Being and all these rights that He has, which we must acknowledge, because we've not put it into the training and inculcated it into the practice of those students as they continue in their medical education. By the time he qualifies, he doesn't remember that. He thinks whatever he did, nobody saw, nobody knows he made a mistake, so he can keep quiet.
Yet God
But
is watching.
if we've trained them that God is watching, and in the Islamic principle, it is there that Allah is watching you and can see what you are doing, and therefore when you are conscious, you have that God consciousness, you will own up. Even if nobody else noticed, even if nobody complained, you will own up because you know God saw it. God has noticed. Yeah? And you are afraid more of Him than of losing a little bit of money or what by compensating the patient.
So what we are saying is the difference is God consciousness.
God consciousness,
right?
Absolutely.
The liability, responsibility and liability. Then the end of life, like the sanctity of life.
Sanctity of life, yes.
And that if you reach a point where there's a major decision, it's the medical to make that decision rather than family. Because family, then you start wondering, is it the wife, is it the child, is it the parent, is it the brother who has more rights?
And are they looking forward to the inheritance?
Yeah.
That they are getting impatient and don't want to wait for the person to die in their own time?
Yeah, so basically what we are seeing is that the Islamic ethical position is actually the simpler one to adopt and to apply.
And it is all-encompassing and
comprehensive.
Very comprehensive. Thank you. I was searching for that word. And the sincere counseling,
right,
and good advice that the physician is supposed to give that patient and say, this is my sincere, and without any ulterior motive.
Okay.
It's so not expounded in contemporary medicine, but it is very well expounded here.
Okay. So I think I also read that it's the gratitude. The physician should also be very grateful to the parents, and also some of the characteristics should be like humility, modesty, patience, tolerance, integrity. The list goes on. That this is to have that physician mindset, Islamic physician mindset.
And of those, I think humility is the one that is top on that list. That humility will make that physician practice. His practice will be of much better, of higher quality with that humility compared to one who may be courteous and respectful but doesn't have that humility.
Exactly.
I think that's really very good.
So I think we have really covered this contemporary medical ethics vis-a-vis the Islamic code of ethics very well.
I hope so. I think so. Inshallah, we might have missed, and if we missed anything, then we are human, and it is human to err. We have to accept that.
Yes, but hopefully we've done a good job. So, what ethical challenges? What are the common ethical challenges that Muslim health professionals may come across and that they'll, have to deal with?
Like I think a general one would be that Muslim health professionals who are employed in facilities to provide care, some employees give not just goals but certain what's the word that they must achieve.
Targets.
Yes,
targets,
having a senior moment there. Targets that they must achieve, and it then influences their decision.
True.
Profit
driven.
Unfortunately, because some of these institutions are providing these health facilities more for profit making and not for caring for the well-being of humanity and the community.
Right.
So that's a common one where they are given targets of how many patients they must admit in a month, how many surgeries they must do in a month, how many laboratory investigations they must do in a per patient, whether the patient needs it or not.
And how many drugs to pump,
and how the prescriptions exactly, or which ones need to be prescribed. Sometimes some of this influence is so subtle from the pharmaceutical companies that even the physician doesn't realize that his decision has been influenced. Again, I think that's a discussion for another time. That's one. Okay. Then two, with medical advancements, certain things have come up that are putting physicians in
ethical dilemma.
For example, in reproductive medicine, we can say surrogacy, or transplant of reproductive organs from one individual to another. It means we are transferring the DNA of that person to this recipient, and that transfer of DNA does have implications in families, in inheritance.
Wow.
Yes, or sperm banks for the infertile couples.
Right. Or even milk banks.
And milk banks.
Imagine, in the neonate newborn units, now milk banks are posing ethical dilemmas.
True, milk banks,
something
exactly.
that you're thinking is life-saving.
Exactly. And
can you explain the ethical dilemma of milk banks for Muslims?
Actually, in fact, I was reading that some ulamas in some countries have even given some fatwas.
Oh, so it's okay.
No, on some of these milk banks. I didn't get time to go into the details, but it looks like some of the Muslim countries have gone far ahead and looked into these issues to provide guidance.
Yeah, for those listeners who might not be Muslims, it's that if a baby, the mother is unable to breastfeed, then they get milk from, in Islam, you would get maybe another foster mother to breastfeed. And if this baby gets more than 3 feeds and they're full, then the children of that foster mother he or she cannot get married. So in milk banks now, you have babies in the nursery. That means that all the mothers that are donating milk, you need to certify them, so that as this child grows up, in case they want to get married, you make sure that those mothers who donated their children are not
Are excluded. Yes.
It's
yes, that's the
something that
challenge.
you can't imagine as a non-Muslim, but it's actually existing.
Absolutely.
So
absolutely.
this is what we're
Imagine
referring
just
to.
3 feeds. 3 feeds where the baby is fully satisfied.
Mhm.
Makes
all those families out
out
from marriage.
as marital possible marital spouses for future. Exactly.
Yes.
So that's the challenge, and then comes abortion.
Yes.
Um,
Whether to terminate a pregnancy,
because or not.
We're getting all these ultrasounds and CT scans done, and you're told this fetus is not going to be viable, they'll be born without brains or organs, and so they recommend that you terminate. Yeah,
they recommend that you terminate, exactly. But but in the
Islamic position,
Islamic position is very clear that you can only terminate a pregnancy if the mother is going to be harmed. So the mother's life takes precedence over the baby. Why? Because if the baby dies, it's okay. The mother can still conceive and have another child.
Right.
But if the mother dies, there's no hope of that family getting other children. And again, this must be certified by specialists.
Yes.
Okay, in the Islamic principle. And the other condition is this must be done early in pregnancy, in the first trimester.
Okay.
And I think the implications why first and not second or third trimester, where possible, if the information is available that early, it has implications, emotional implications on the mother, on the family, and many other situations. Okay. Just because a baby has congenital malformations is not a reason to terminate pregnancy according to Islamic ethics.
Exactly. If, for example, the gender, even choosing the gender of the fetus, it's only allowed in the Islamic principles if it has implications on disease transmission. Okay. For example, we know disease like hemophilia. It's transmitted to the male gender. Females are only carriers. Oh, really? Okay.
Yes.
I didn't know that.
Yes, females are only carriers in the commonest hemophilia. There is another bleeding disorder where women can also get it, but the major one, hemophilia A and B, women just behave as carriers. Is the male gender.
So you're saying they can terminate such a pregnancy?
According to one of the fatwas I was reading, they say if it has that kind of implication in the family. But this is a decision of one group of ulamas. I can't remember whether it was Egypt or Saudi Arabia that made that decision. So these are some of the challenges. The other challenge is euthanasia. Exactly. In a person who has terminal illness, there's no cure, there's no hope of survival. Euthanasia in modern medicine allows the
mercy killing.
But again, even in contemporary medicine, some of the modern or developed countries allow it, some don't. But in Islam, of course, it's not allowed.
Exactly.
Euthanasia is not allowed.
Okay.
Another one. So, and then all these things that are coming, cloning, DNA, manipulations,
transgender, sexual,
exactly. Or even transplanting
organs.
Secondary sexual organs into a person who was originally male, and now they want to they
Convert
think
to
and
female.
feel they are female, so they want to be converted to become female. Where
Those
which
are ethical.
yeah, those are being practiced in some countries in contemporary medicine. Again, even in the modern world, some of the developed countries, they do not allow this, but in Islam is certainly not allowed.
Wow. So we have so many, and as medicine advances, it's just more and more.
Exactly.
But the point is that Islamic medicine is so far visionary. The vision and the principles can be applied.
Exactly.
They are just endless. They're infinite. Basically.
Exactly.
That's what we're learning here, right?
Yes,
Okay.
they can be applied,
Okay.
and if the physician feels when he's applying he's still not sure he's making the right decision, he can refer the decision to the ulamas of that country or region and get advice of what to do so that he still is within the Islamic ethics.
So ulamas are like the scholars.
Sorry.
Scholars.
These are the Islamic scholars of jurisprudence and fiqh, and that have gone in depth into decision making and what is allowed and what is not allowed within the Islamic principles. Yes.
Okay, thank you. Now we are about to reach our conclusion. What recommendations would you have for how to integrate, all these broad and extra Islamic code of ethics with the contemporary medical ethics, particularly, in the context of Muslim health practitioners or even the Kenyan health system?
I think Muslims should forge ahead like our predecessors who started medical practice in the 6th and 7th century. We should feel bold and say medicine needs to incorporate some of these things that are missing to make it holistic, to make it sensitive, to make it comprehensive. We cannot exclude some of these issues, and especially excluding the supreme right of the Creator to give and take life, and that He is again the final one who actually heals.
I think I agree. Kenya, as we know, we are a very religious country. Every meeting you go we begin with, can we pray? And we end with, let's pray again. So why have we, removed the religion from health in this case? And yet we can see for optimal patient care and benefits, it's time to bring them back together.
Absolutely. They are not exclusive, and they need to be included. So I think the Muslims can forge ahead and go ahead and come up with a course which they can offer, not just to Muslims, to anybody who would like to incorporate these very good principles into their practice, so that they give better care to the patients, and this way we will enrich the health profession, and patients will get better care, and will be more satisfied.
True.
Really, our patients will definitely be more satisfied when they see us incorporating all these things. That before you touch a patient, you say Bismillah, and Alhamdulillah after you finished, and those little things here and there. But especially when the patients are people who believe in God, when they see you giving God his due respect, as you do your normal practice, they will that psychological and spiritual part of them will be satisfied well. And then we would even go back to the Alma Ata declaration, where health is defined not just physical but mental and spiritual.
True.
So we've ignored this last spiritual, and yet it has been defined in the Alma Ata declaration many years ago. We've ignored it, and so we can forge ahead, and we can go into into this frontier and remind ourselves that complete health includes spiritual.
I think so.
And if we're going to include spiritual, then including Islamic medical ethics and into our contemporary ethics is a non-negotiable decision.
Very true. I think thank you very much. We've had a very informative session. I hope that this session has enlightened even the non-Muslims, and we shall be engaging in another episode we shall have, where we shall dwell more into how to integrate actually these Islamic bioethics into the medical education with medical ethics. And in that episode, we hope, inshallah, to bring in now the scholars into the dialogue. So please stay tuned, and we shall look forward to being with you again. Dr. Fatma, any last part in short?
Just to express my sincere gratitude for having chosen me to get involved in this discussion. I don't know why, but I'm grateful to have been able to give my little input and my little opinion into it, and I'm hoping and praying that it will contribute to the overall good of the health profession and to the overall good of the health of the whole of humanity.
No, I think everyone appreciates you. Those who are in the university, every time she's out there, the young doctors is, "Oh, you taught me, So the patients appreciate the community. So we thank you very much. You're very experienced in the ethics board, and you're one of the role models for the Muslim women especially. Thank you very much.
Shukran. Jazakallah khair.
Thank you.